Would you like free audiobooks? Click the link in the description. Question 1. A nurse is caring for a patient with a suspected stroke. Which assessment finding would require immediate intervention? A. Sudden onset of confusion. B. Blood pressure of 150/90 millimeters of mercury. C. A temperature of 37.8 degrees Celsius 100 degrees Fahrenheit. D. Complaints of a headache. Correct answer. A. Sudden onset of confusion. Rationale. Sudden onset of confusion in a patient with a suspected stroke indicates an acute change in neurological status, potentially due to increased intracranial pressure or progression of the stroke. Immediate intervention is necessary to prevent further brain injury. Blood pressure of 150/90 millimeters of mercury, while elevated, is not uncommon in acute stroke and does not require immediate intervention compared to a change in consciousness. A temperature of 37.8 degrees Celsius, although it needs monitoring, is not as critical as the neurological changes. Headaches may be associated with stroke but are not as urgent as sudden changes in mental status. Question 2. A patient with Parkinson's disease is admitted to the healthcare facility. Which nursing intervention is most important to include in the patient's care plan? A. Encourage intake of high-protein meals. B. Implement fall prevention strategies. C. Administer antiparkinsonian medications in the evening. D. Restrict fluids to prevent urinary incontinence. Correct answer. B. Implement fall prevention strategies. Rationale. Patients with Parkinson's disease have impaired balance and coordination, increasing their risk of falls. Implementing fall prevention strategies is crucial to ensure safety and prevent injuries. High-protein meals can interfere with the absorption of levodopa, a common medication for Parkinson's, and should be balanced throughout the day rather than concentrated. Antiparkinsonian medications should be administered according to a schedule that optimizes their effectiveness, which often spans throughout the day rather than only in the evening. Restricting fluids is not advisable as it can lead to dehydration. Instead, managing fluid intake to avoid nocturia might be beneficial. Question 3. A nurse is performing a neurological assessment on a patient. Which finding would be considered normal? A. Positive Babinski sign. B. Unilateral pupil dilation. C. Brisk, deep tendon reflexes. D. Absence of sensation in the legs. Correct answer. C. Brisk, deep tendon reflexes. Rationale. Brisk deep tendon reflexes can be normal in some individuals, especially if they are symmetrically brisk and no other neurological deficits are present. A positive Babinski sign, upward toe movement, is abnormal in adults and indicates central nervous system damage. Unilateral pupil dilation could suggest a neurological injury or increased intracranial pressure and requires immediate investigation. Absence of sensation in the legs indicates a sensory deficit and is not a normal finding. Question 4. A nurse is caring for a patient who is post-operative day 1 following a lumbar laminectomy. Which of the following actions should the nurse prioritize? A. Encourage the patient to remain in bed for 72 hours. B. Assist the patient in performing leg exercises every 2 hours. C. Administer prescribed analgesics prior to physical therapy sessions. D. Instruct the patient to avoid deep breathing exercises to prevent strain. Correct answer. C. Administer prescribed analgesics prior to physical therapy sessions. Rationale. Pain management is crucial after a lumbar laminectomy to facilitate mobility and participation in physical therapy, which is vital for recovery. Administering prescribed analgesics before sessions can increase patient comfort and participation. Encouraging the patient to remain in bed for extended periods contradicts current postoperative care recommendations, which promote early ambulation to prevent complications. Leg exercises are important but should be balanced with rest and not necessarily performed as frequently as every 2 hours unless specified. Deep breathing exercises are essential postoperatively to prevent atelectasis and pneumonia, and patients should not be instructed to avoid them. Question 5. The nurse is preparing to administer carbamazepine for a 16-year-old patient diagnosed with epilepsy. Which of the following nursing actions is most appropriate prior to administration? A. Check the patient's allergy status for penicillin. B. Review the patient's most recent sodium levels. C. Ensure the patient has consumed a full meal. D. Measure the patient's intracranial pressure. Correct answer. B. Review the patient's most recent sodium levels. Rationale. Carbamazepine can cause hyponatremia, low sodium levels, so it's important to check the patient's sodium levels before administration to prevent exacerbation of this condition. While checking for allergies is important, there is no direct cross-allergenicity between carbamazepine and penicillin. Consuming a full meal may help with gastrointestinal tolerance, but is not the most critical action related to carbamazepine administration. Measuring intracranial pressure is not related to carbamazepine administration and is more invasive, typically reserved for patients with conditions that may lead to increased intracranial pressure. Question 6. A patient with a traumatic brain injury, TBI, is being monitored in the ICU. The nurse observes a sudden increase in systolic blood pressure, widening pulse pressure, bradycardia, and irregular respirations. The nurse interprets these findings as indicative of A. Neurogenic shock. B. Paroxysmal sympathetic hyperactivity. C. Cushing's triad. D. Meningeal irritation. Correct answer. C. Cushing's triad. Rationale. Cushing's triad, characterized by an increase in systolic blood pressure, widening pulse pressure, bradycardia, and irregular respirations, indicates increased intracranial pressure, ICP, and is a medical emergency. It suggests that brain herniation may be imminent. Neurogenic shock typically presents with hypotension and bradycardia, not hypertension. Paroxysmal sympathetic hyperactivity is associated with episodes of increased sympathetic activity, i.e., hypertension, tachycardia, following TBI, but does not specifically include the features of Cushing's triad. Meningeal irritation typically presents with headache, fever, and nuchal rigidity, not the hemodynamic and respiratory changes seen in Cushing's triad. Question 7. A nurse is assessing a patient who reports difficulty swallowing and weakness in the arms and legs after receiving botulinum toxin injections for cosmetic purposes. The nurse should be concerned about which of the following conditions? A. Anaphylactic reaction. B. Botulism. C. Guillain-Barré syndrome. D. Myasthenia gravis. Correct answer. B. Botulism. Rationale. Botulism, a rare but serious illness caused by botulinum toxin, can occur if the toxin spreads beyond the injection site. Symptoms include difficulty swallowing, muscle weakness, and respiratory compromise. An anaphylactic reaction would more likely present with urticaria, angioedema, and respiratory distress. Guillain-Barré syndrome is an autoimmune condition that causes ascending paralysis, typically following an infection, not botulinum toxin exposure. Myasthenia gravis is a chronic autoimmune neuromuscular disorder characterized by varying degrees of weakness of the skeletal muscles, not typically triggered by botulinum toxin injections. Question 8. During a neurological assessment, a nurse asks a patient to stand with their feet together and arms at their sides, first with eyes open and then with eyes closed. The patient is unable to maintain balance when their eyes are closed. The nurse documents this finding as A. Positive Romberg sign. B. Negative Romberg sign. C. Positive Babinski sign. D. An abnormal gait. Correct answer. A. Positive Romberg sign. Rationale. A positive Romberg sign is indicated when a patient is unable to maintain balance with their eyes closed, suggesting a problem with proprioception or sensory ataxia. It indicates a disturbance in the dorsal columns of the spinal cord or peripheral nerves that convey proprioceptive information. A negative Romberg sign would be if the patient could maintain balance with eyes closed. The Babinski sign involves reflex testing, unrelated to balance or gait. An abnormal gait could be indicated by other assessments, but the Romberg test specifically assesses balance, with visual input removed. Question 9. A patient experiencing a severe migraine headache is prescribed sumatriptan. The nurse understands that the primary action of this medication is to A. Dilate cerebral arteries to increase blood flow to the brain. B. Inhibit the reuptake of serotonin in the central nervous system. C. Constrict cranial blood vessels and reduce inflammation. D. Block calcium channels to prevent migraine progression. Correct answer. C. Constrict cranial blood vessels and reduce inflammation. Rationale. Sumatriptan is a selective serotonin receptor agonist that works by constricting cranial blood vessels and reducing inflammation, which are believed to be part of the pathophysiology of migraine headaches. This action helps alleviate the symptoms of migraines. Dilating cerebral arteries could potentially worsen migraine symptoms by increasing intracranial pressure. Sumatriptan does not work by inhibiting the reuptake of serotonin or blocking calcium channels. Those are mechanisms of action for other types of medications. Question 10. A nurse is caring for a patient who has been diagnosed with amyotrophic lateral sclerosis, ALS. Which nursing intervention is most appropriate for managing this condition? A. Providing high-intensity exercise routines. B. Implementing passive range of motion exercises. C. Administering anticholinergic medications regularly. D. Encouraging increased protein intake to promote muscle strength. Correct answer. B. Implementing passive range of motion exercises. Rationale. For patients with ALS, maintaining joint mobility and preventing contractures are important goals. Implementing passive range of motion exercises helps achieve these goals by keeping the joints flexible and muscles as healthy as possible. High-intensity exercises are not recommended due to muscle weakness and fatigue associated with ALS. Anticholinergic medications may be used to manage symptoms such as excessive salivation but are not a primary intervention for ALS management. While nutritional support is important, increasing protein intake alone does not promote muscle strength in ALS due to the progressive nature of the disease, which leads to muscle wasting. Question 11. A nurse is planning care for a patient with a history of seizures who is scheduled for an electroencephalogram, EEG. To ensure the accuracy of the test, what instruction should the nurse emphasize? A. Avoid drinking coffee or consuming any caffeine on the day of the test. B. You will need to shave your head prior to the test for electrode placement. C. Please fast for at least 8 hours before the test. D. Continue to take all of your prescribed medications as usual. Correct answer. A. Avoid drinking coffee or consuming any caffeine on the day of the test. Rationale. Caffeine can alter the results of an EEG by affecting brainwave patterns. Therefore, patients are usually advised to avoid caffeine for at least 8 to 12 hours before the test. Shaving the head is not necessary for an EEG, as electrodes can be placed on the scalp without removing hair. Fasting is not required for an EEG, unlike some other procedures. Patients are typically advised to continue their prescribed medications unless specifically instructed otherwise, as stopping antiepileptic drugs could provoke seizures, which, while potentially informative during the test, could pose a risk to the patient. Question 12. A patient with multiple sclerosis, MS, reports experiencing increased fatigue, especially in the afternoon. Which of the following recommendations is most appropriate for the nurse to make? A. Limit fluid intake to reduce the need for bathroom trips, which can be tiring. B. Schedule a daily exercise session in the afternoon to boost energy levels. C. Plan for short, frequent rest periods throughout the day to conserve energy. D. Increase consumption of caffeinated beverages to help combat afternoon fatigue. Correct answer. C. Plan for short, frequent rest periods throughout the day to conserve energy. Rationale. Fatigue is a common symptom of MS and can significantly impact daily activities. Recommending short, frequent rest periods can help the patient manage energy levels more effectively throughout the day. Limiting fluid intake is not advisable as it can lead to dehydration and exacerbate fatigue. While regular exercise is beneficial for patients with MS, scheduling it during a time when the patient already experiences increased fatigue might not be helpful and could potentially worsen fatigue. Increasing caffeine intake may temporarily alleviate fatigue but can interfere with sleep patterns and lead to increased fatigue in the long term. Question 13. A nurse is caring for a patient who has recently been diagnosed with Guillain-Barré syndrome, GBS. The nurse recognizes that the priority nursing intervention is to A. Encourage frequent ambulation to prevent muscle atrophy. B. Monitor for signs of respiratory distress. C. Implement a high-protein diet to facilitate nerve repair. D. Administer aspirin for pain relief as needed. Correct answer. B. Monitor for signs of respiratory distress. Rationale. Guillain-Barré syndrome can progress rapidly, potentially affecting the muscles involved in respiration. Monitoring for signs of respiratory distress is a priority to promptly identify respiratory compromise, which may necessitate mechanical ventilation. While physical therapy and nutrition are important components of care for GBS, they are not the immediate priority. Aspirin may be contraindicated due to the risk of bleeding, especially if the patient is receiving treatments like plasmapheresis or intravenous immunoglobulin, which are common for GBS. Pain management should be tailored to the patient's needs, but monitoring respiratory function is critical due to the risk of respiratory failure. Question 14. When educating a patient with trigeminal neuralgia about facial pain management, the nurse should include which of the following instructions? A. Apply heat packs to the face for 20 minutes every 2 hours. B. Chew gum regularly to strengthen jaw muscles. C. Wash the face with cold water several times a day. D. Avoid triggers such as cold wind or hot beverages. Correct answer. D. Avoid triggers such as cold wind or hot beverages. Rationale. Trigeminal neuralgia is characterized by sudden, severe facial pain triggered by stimuli to the affected areas of the face. Patients are advised to avoid known triggers, such as exposure to cold wind or consuming very hot or cold beverages, to reduce the frequency of pain episodes. Applying heat packs, chewing gum, or washing the face with cold water could potentially trigger an episode of pain and are not recommended for managing trigeminal neuralgia. Identifying and avoiding triggers is a key strategy in managing this condition. Question 15. A nurse is assessing a patient with a suspected concussion following a minor head injury. Which of the following symptoms would the nurse prioritize for immediate medical evaluation? A. Headache. B. Short-term memory loss. C. Nausea. D. Drowsiness. Correct answer. B. Short-term memory loss. Rationale. While all the listed symptoms can be associated with a concussion, short-term memory loss, amnesia, might indicate more significant brain injury and warrants immediate medical evaluation. Memory loss, especially if it persists or worsens, could be a sign of a more serious injury than initially suspected. Headache, nausea, and drowsiness are common post-concussion symptoms, but are not as immediately concerning as changes in memory or consciousness, which could indicate a need for further diagnostic testing or intervention. Question 16. A nurse is educating a patient with a newly inserted ventriculoperitoneal (VP) shunt for hydrocephalus. Which instruction is most important for preventing complications related to the shunt? A. Avoid contact sports to prevent damage to the shunt. B. Check the shunt daily for signs of infection or leakage. C. Monitor for abdominal pain, as it may indicate shunt malfunction. D. Report signs of increased intracranial pressure, ICP, immediately. Correct answer. D. Report signs of increased intracranial pressure, ICP, immediately. Rationale. Reporting signs of increased ICP, such as headache, vomiting, altered consciousness, or visual disturbances, is crucial for patients with a VP shunt. These symptoms may indicate shunt malfunction or blockage, requiring prompt medical evaluation and possibly surgical intervention. While avoiding contact sports is important to prevent physical damage to the shunt, and monitoring for infection or abdominal pain is part of ongoing care, the immediate reporting of symptoms indicating increased ICP is essential for preventing serious complications, including brain damage. Question 17. A patient with a history of epilepsy is being discharged from the hospital after a seizure. What advice should the nurse include in the discharge teaching to help manage seizures at home? A. Take anti-epileptic drugs, AEDs, only when you feel a seizure coming on. B. Maintain a regular sleep schedule and avoid sleep deprivation. C. You can skip doses of your AEDs if they cause unwanted side effects. D. Alcohol can be consumed in moderation without affecting your seizures. Correct answer. B. Maintain a regular sleep schedule and avoid sleep deprivation. Rationale. Sleep deprivation is a well-known trigger for seizures in individuals with epilepsy. The nurse should emphasize the importance of maintaining a regular sleep schedule and avoiding situations that lead to significant sleep loss. Consistent adherence to prescribed anti-epileptic drugs, AEDs, is critical for seizure control, and doses should not be skipped or adjusted without consulting a healthcare provider. Alcohol consumption can lower the seizure threshold and interact with AEDs, potentially worsening seizure control, and should generally be avoided or minimized. Question 18. A nurse is caring for a patient who has just undergone a craniotomy. Which post-operative assessment finding necessitates immediate intervention? A. Pain at the surgical site. B. Swelling around the eyes. C. Drainage from the nose. D. Mild headache. Correct answer. C. Drainage from the nose. Rationale. Post-operative drainage from the nose following a craniotomy could indicate a cerebrospinal fluid, CSF, leak, which poses a risk for meningitis and requires immediate intervention. While pain, swelling around the eyes, and a mild headache can be expected post-operative symptoms and should be managed appropriately, nasal drainage of clear fluid is a significant concern that must be addressed urgently to prevent complications. Question 19. During a health screening, a nurse advises a patient with a family history of Alzheimer's disease on strategies to reduce the risk of developing the disease. Which of the following recommendations is evidence-based? A. Increase intake of high-fat foods to promote neuronal health. B. Engage in regular physical exercise and mental stimulation activities. C. Take ginkgo biloba supplements daily to enhance memory. D. Isolate socially to reduce stress and cognitive load. Correct answer. B. Engage in regular physical exercise and mental stimulation activities. Rationale. Evidence suggests that regular physical exercise and engaging in mentally stimulating activities can help reduce the risk of developing Alzheimer's disease or slow its progression. These activities promote brain health by improving blood flow and encouraging the development of new neural connections. High-fat diets, especially if they include a lot of saturated fats, are not recommended for neuronal health or Alzheimer's prevention. While some people use ginkgo biloba to try to improve memory, scientific evidence supporting its effectiveness in preventing Alzheimer's disease is limited. Social isolation is associated with increased risk of cognitive decline. Maintaining social connections is beneficial for cognitive health. Question 20. A nurse is teaching a group of nursing students about the pathophysiology of a stroke. Which statement by a student indicates an understanding of the primary difference between ischemic and hemorrhagic strokes? A. Ischemic strokes are caused by bleeding in the brain, while hemorrhagic strokes are caused by a blood clot. B. Hemorrhagic strokes result from a rupture of blood vessels, while ischemic strokes are due to vessel obstruction. C. Ischemic and hemorrhagic strokes both involve blood vessel rupture but differ in location. D. There is no significant difference in the initial treatment approach for ischemic and hemorrhagic strokes. Correct answer. B. Hemorrhagic strokes result from a rupture of blood vessels, while ischemic strokes are due to vessel obstruction. Rationale. Hemorrhagic strokes occur when a weakened blood vessel ruptures and bleeds into the surrounding brain, whereas ischemic strokes are caused by an obstruction within a blood vessel supplying blood to the brain, often due to blood clots. The statement correctly identifies the primary pathophysiological difference between the two types of strokes. The initial treatment approaches for ischemic and hemorrhagic strokes differ significantly, emphasizing the importance of accurate diagnosis. Question 21. A nurse is monitoring a patient for signs of increased intracranial pressure, ICP. Which symptom is an early indicator that should prompt immediate further assessment? A. Fixed and dilated pupils. B. Decerebrate posturing. C. Change in level of consciousness, LOC. D. Hypertension with a widened pulse pressure. Correct answer. C. Change in level of consciousness, LOC. Rationale. A change in LOC is often the earliest indicator of increased ICP. This may manifest as confusion, drowsiness, or decreased responsiveness. Early detection and intervention can be critical in preventing further neurological deterioration. Fixed and dilated pupils, decerebrate posturing, and hypertension with widened pulse pressure are later signs of significantly increased ICP and impending herniation, indicating more advanced and severe intracranial pathology. Question 22. A nurse is providing discharge instructions to a patient who has been prescribed phenytoin for seizure control. Which statement by the patient indicates a need for further teaching? A. I will wear a medical alert bracelet indicating I take phenytoin. B. I understand I should avoid consuming alcohol while taking this medication. C. I can skip doses if I experience side effects, like gum overgrowth. D. I will follow up with my healthcare provider regularly to monitor my blood levels. Correct answer. C. I can skip doses if I experience side effects like gum overgrowth. Rationale. Skipping doses of phenytoin can lead to subtherapeutic levels and increased seizure risk. Gum overgrowth, gingival hyperplasia, is a known side effect of phenytoin, but management involves good oral hygiene and possibly seeing a dentist, not skipping medication. Wearing a medical alert bracelet, avoiding alcohol, and regular follow-up for blood level monitoring are appropriate actions when taking phenytoin. Question 23. A patient with a spinal cord injury at the T6 level is experiencing a sudden onset of headache, sweating above the level of injury, and bradycardia. The nurse recognizes these symptoms as indicative of A. Autonomic dysreflexia. B. Neurogenic shock. C. Spinal shock. D. Orthostatic hypotension. Correct answer. A. Autonomic dysreflexia. Rationale. Autonomic dysreflexia is a potentially life-threatening condition that can occur in individuals with spinal cord injuries above T6. It is characterized by acute onset hypertension, bradycardia, pounding headache, and sweating above the level of injury due to an exaggerated autonomic response to a stimulus such as a full bladder or bowel. Immediate identification and removal of the offending stimulus are crucial to prevent severe complications. Neurogenic shock, spinal shock, and orthostatic hypotension present with different symptoms and are managed differently. Question 24. When assessing a patient with a head injury, the nurse notes that the patient's pupils are unequal. The nurse documents this finding as A. Anisocoria. B. Nystagmus. C. Ptosis. D. Mydriasis. Correct answer. A. Anisocoria. Rationale. Anisocoria refers to unequal pupil sizes, a condition that can be a sign of neurological injury or damage, particularly when associated with a head injury. It may indicate increased intracranial pressure or damage to the cranial nerves involved in eye movement and pupil constriction. Nystagmus is characterized by rapid, uncontrollable eye movements. Ptosis is a drooping of one or both eyelids. Mydriasis refers to pupil dilation, not inequality in size. Question 25. A nurse is planning care for a patient with Bell's palsy. Which intervention should be included to prevent complications associated with the condition? A. Administer anticoagulant therapy to prevent stroke. B. Apply warm compresses to the affected side of the face. C. Teach the patient to blink regularly to lubricate the eyes. D. Instruct the patient to chew on the unaffected side of the mouth. Correct answer. B. Apply warm compresses to the affected side of the face. Rationale. Applying warm compresses to the face can help reduce discomfort and may improve blood flow in patients with Bell's palsy, a condition characterized by sudden, temporary weakness or paralysis of the facial muscles on one side of the face. Teaching the patient to blink regularly is important, but the use of artificial tears or eye protection might be more directly relevant to preventing eye complications due to decreased blinking and eyelid closure. Chewing on the unaffected side can help with eating difficulties, but it does not directly prevent complications. Anticoagulant therapy is not indicated for Bell's palsy as it is not related to stroke risk in this context. Visit nursestudy.net for more nursing practice exams, care plans, and study guides.